Welcome to Digital Visionaries. Today, we're joined by Mark Kandrysawtz, SVP and Chief Innovation Officer at WellSpan Health, a system that's not just adopting digital tools, but fundamentally rethinking how healthcare is designed, delivered, and experienced. Mark is a true digital visionary, and we're delighted to have him on the show. Mark, thanks so much for joining me.
Thanks for having me.
Mark, tell me about your journey in innovation and what has led you to this point to becoming the SVP and Chief Innovation Officer here at WellSpan Health.
It's a great question, largely because innovation is a word that means everything and nothing all at the same time now. And so my point of view around innovation is really informed by my own professional journey, which started a long time ago in PR and advertising. And when I started my career, I began working in a really creative-centric agency where I really was exposed to and fell in love with the power of creativity as a business tool, which is pretty under-leveraged, I think, in the business environment.
I would say so.
It was also at a time of the emergence of the consumer web, where brands were just starting to learn how the internet would change the way that they did business with their consumers. And that creative world kind of split. And some agencies followed the traditional creative methods, and others started to explore the role of the internet, and kind of the tech and experience design sector was born. I followed that path, and for about a decade spent time working kind of in a dichotomy. I worked for a firm that spent half of its time in the Bay Area of California working with early stage funded startups, where we were exposed to the latest and kind of innovative thinking, not just with technology, but with design, and the way that they were really embracing creating new experiences with the consumer at the center. And we took that innovator spirit and brought it back to innovation-starved industries like government, finance, education, and healthcare. And I really fell in love with the work we were doing in healthcare, recognizing that kind of ironically, that human-centered approach was really missing in the healthcare sector. And so I founded a company called Benjamin & Bond, which was a healthcare design consultancy focused on transforming healthcare using human-centered design methods. I partnered with WellSpan through our Benjamin & Bond experience for several years. And then I joined the organization through the acquisition of Benjamin & Bond, where together we formed a new team called WellSpan Innovations.
Okay, and from a digital innovation perspective at WellSpan, what does that look like in your mind?
Well, it's evolved over the last 5 years. So WellSpan is a plan-driven organization. So we have strategic plans that help us keep our eye on the prize of what we're trying to achieve. And so the 2025 plan that launched in 2020 really set out our ambition to develop innovation competencies that we knew were going to be important as we faced increasing headwinds that made the business of healthcare harder. And now as we look to 2030 and launch that plan, we're doubling down on our innovation efforts, not just because those business challenges have continued to get harder, but because we've recognized that consumers now have a powerful voice in their choice for healthcare, and that innovation and human-centered design are going to be key competencies for us to deliver the very best healthcare experience in our markets.
Yeah, and I love that innovation-centered design aspects to it as well. How do you embed that human-centered design into the patient experience at WellSpan?
Well, it's a good question. So for us, it starts with a deep understanding of the users that we're serving. So that means a lot of firsthand research with our consumers, studying their experience, listening to them, and using what we learn about them to inform our strategies. We also do the same thing with our team members. So just as we're trying to deliver the most frictionless and most personalized consumer experience, we aim to do the same thing for our team members.
So that means everyone from nurses, doctors, people behind the scenes, working imaging machinery. How does that factor into the overall innovation work stream that you're leading?
Well, it's a pretty meaningful part of it. So we're treating all audiences in that healthcare paradigm with equal focus and attention. What we know is that healthcare is a problem-rich environment, and there's a lot of team members that experience friction in their work every single day. I like to think that WellSpan is in a post-consumerism mindset, which means it's no longer a debate. that our consumers have choice and we need to treat them as consumers. And that means designing our services around them. We all get it and we're doing it. But we really need to turn that same attention to our team members and recognize that if we listen to them and invite them to the design table, that we can deliver a much better work experience.
Yeah, and that obviously flows through all the way to the customer experience and then
Yeah.
drives that overall. I'm here today on behalf of Sitecore. WellSpan is a really key customer in the healthcare space. Can you talk to me about some of the things and some of the projects that you're working on with Sitecore right now?
Yeah, sure. So Sitecore forms the basis of our consumer platform. So our consumer ecosystem is built around our flagship website, wellspan.org, and our patient portal, which is a combination of our consumer experience and MyChart provided by Epic, where we now have arguably more features and functionality enabled for our consumers than any other health system in the world. And what that really tells us is that the more features and functionality that we deliver historically has driven adoption, where today almost 80% of our consumers have and use their digital experience meaningfully as part of their healthcare journey. What we see as we look to the future is that we need to build upon that foundation of functional capability to deliver the most frictionless experience and most personalized experience. And our foundations with Sitecore will help us execute that.
We know a lot about in the marketing industry. You said you've been in the creative space for quite some time. That promise of personalization has been talked about for probably upwards of 15 years. But I think you're almost on the precipice of something really amazing here at WellSpan, because the patient experience is truly unique. There is no two patients that are the same. There's no two broken arms that look exactly like they should. How do you think about that when it comes to really being able to push a really personalized experience to each of those unique individuals?
Well, on its surface, it may seem antithetical, but the first step is really to drive systemness and standardization. So think about your last healthcare experiences. When you walk through the door, you're asked to fill out forms and give personal information, and you may have a different appointment the next day, and it starts all over again. And so we've put a lot of noise and friction into the experience, which has taken away our uniquely human opportunity to deliver that empathetic, personalized experience. So by doing the hard work to deliver a standard, consistent, and familiar experience, which means not asking you for that same information over and over and over again, it creates the human bandwidth to get to know you as a person and deliver care that reflects what we know about.
Yeah, I think we've all been there in those scenarios, right? Where we go back into the clinic, it's like fill that form out again one more time. So I love the way you're thinking about that when you're pulling together that foundational work that's going to allow you to really drive that type of great care for your customers, which is ultimately what you're after. Let's shift gears a little bit into overall digital strategy and AI. AI is almost like that favorite four-letter word in the industry right now. How are you thinking about some of the advances that AI can bring to WellSpan as a whole, but also in particular from a digital experience perspective?
It's a great question. I would characterize our attitude towards AI as being bullish. We are at an inflection point of capability that allows us to tackle redesign and rethinking of healthcare in a way that we really technically couldn't in the past. So it is a new era of capability. Our approach, though, however, is really to stay true to our design approach, which means AI is a tool in the toolkit that enables our most ambitious ideas for what a healthcare experience could actually look like. The other thing to recognize is that AI is not one thing. And so it can deliver value in different ways in different areas of the experience. That might include directly with you as our consumer and the way you interact with your provider and care team and our organization as a brand, but it might also be in the inner workings of how clinical care is actually delivered and in the way we operate our business. And so our philosophy around AI as part of our design initiative is to really think about it as increasing human capacity for a better healthcare delivered experience. And there's really two main drivers around human capacity. One is time. So AI is uniquely suited to help take on bigger levels and more complex levels of automation with the express intent of giving you, as a healthcare worker, more time for uniquely human work. The other is by augmenting the way you do your work. So giving you better tools that are more equipped with increasing your capability as a human, leaning into what's uniquely human about healthcare work. And so by looking at both automation and returning time and augmentation by increasing your capability, we think we can meaningfully increase human capacity for healthcare work.
That is, I think, a huge goal. But the way you map it out there, I think you make it feel like it's possible that we really start to put that human aspect of healthcare work really at the center. Whereas in the past, there would have been these enormous systems that went around all of these type of experiences. We've all been there where you have to give your medical history to 3, 4, and
Yeah.
5 different people over the course of a journey. If a doctor's not in that day or the next day, you got to start right back from the start. So I think you're almost touching on something that is going to absolutely revolutionize how people think about these things.
Well, and there's urgency. So next year, 2026, in the state of Pennsylvania, there will be a deficit of 20,000 nurses. That's like right now. And so we're never going to have the workforce to deliver what our communities deserve. It's a forever problem. And so we really are approaching it with urgency. And at the same time, we have this scarce resource. We listen to our team members and we know that they're fatigued, that there's friction, that it's hard for them to deliver as their best selves every day at work. And we do meaningful work in healthcare. We touch families at their worst and at their best in moments of sorrow and in joy. And we need to be prepared every day to show up, to be a part of that life experience. And when your day is filled with clicks and friction and navigating complex systems, it takes away from that time where you should be focused exclusively on the person that's in front of you. And not just through AI, but through that design approach and thinking about healthcare work anew for the first time in decades, how it could be delivered. I think we have a real opportunity not just to help manage through the shortage of workforce that we face, but to ensure that our care team members have a uniquely WellSpan great work experience.
Yeah, and I love how you're putting that on a pedestal, the customer experience on a pedestal, but also the employee experience, and how that is actually potentially even going to drive recruitment drives for these type of roles. Because if you think of the type of experience that a nurse would have on a day-to-day basis, not just nurses, doctors, administration staff, it's becoming, I think, it would become a lot more attractive place to work on a day-to-day basis. From an AI perspective, how are WellSpan utilizing AI today, both in a healthcare context and then also from a digital experience perspective as well?
We have initiatives at various stages of development in all areas of the business. So on the consumer side, we are a global leader in the use of agentic AI for autonomous direct interactions with our patients and consumers, community members. I would characterize it as still firmly in the innovation space, but we're rapidly scaling. I'll give you some context for that. We started this work in September of last year. So we began exploring, understanding, we call it discovery, learning about the space and what it might mean. Between September and March, we had completed about 6,000 fully autonomous agentic AI phone calls with our AI care team assistant named Anna. From March to April, we scaled to 260,000 completed interactions. And from April to May, we exceeded the 1 millionth completed interaction. So we're pretty far out ahead, but that's not what's really important. What's really important is that we're learning a lot through that experience. And what we're recognizing is that we have to bring our care team and consumers into this bold new world that we're seeing because it's pretty new. If you think about the fact that this rapid proliferation of AI is really only a couple years old, and you think about that in the grand context of technology development and innovation, we've never seen anything evolve so fast. And so while it's a technical challenge and opportunity, it's also a really important change management initiative to help people understand the value in this crazy new dynamic where you might talk to Anna as part of your care team experience.
I think that's amazing to hear, because you think about the type of profile of customers that would be in the healthcare space, potentially skew a little bit older in some cases. But you mentioned earlier that 80% of your customers are embracing digital digital channels. But that's even, I think, more impressive when you think of you have people who are in their 70s and 80s. If you're hitting that portion of those customers, how can you move that on to 100%, do you think?
Well, AI is infinitely patient, has all the time in the world. You can try to get a negative reaction, and it's not going to happen. And so, in our most difficult moments in healthcare where we need a little bit more time, it gives us that bandwidth in order to do that. And what we find is that very quickly, people who are skeptical or maybe even a little anxious or fearful about the idea of interacting with a computer are quickly won over because of the type of experience that's delivered. And so in our own data from our consumers that are using AI as part of their care experience, we regularly score between 8.6 and 9 out of 10 in their likelihood to recommend Anna as part of their healthcare experience to their friends and neighbors.
That's a phenomenal level of NPS for an interaction with something more technical like that. You mentioned earlier talking about your patients and how you question them and that type of discovery that you do with them. What are some key insights that you've heard more recently that people want to see more of?
I mean, the foundational insight that we know about our communities, so people that live and consume care here in our markets, is that when we treat them as a unique individual, not only are they happier with their care and more engaged, but they're significantly more likely to recommend WellSpan to their friends and neighbors. And at the same time, when they're treated like a number, when all else is great outcome, affordability, all the other key drivers, but if you're treated like a number, you're also significantly more likely to tell someone not to choose an organization. And so it's that wide swing of opportunity in the role that personalization will play. It's key. It's not just important, it is foundational to healthcare choice in our communities.
Tell me a little bit about human in the loop. So when you talk about that handover from Anna, for example, over to a person in that team, how do you think about that handover point and what have you seen so far?
Well, that's a very good question, because it gets to the heart of a core issue with the adoption of AI, which is we are dealing with people's lives. And so it is a little different. You know, in many cases, healthcare tells itself it's different enough and it gives us agency to not focus on the consumer as much as we need to, because we're doing hard, meaningful work. And in many cases, as the innovator, I like to provoke our thinking around that we can do both. We can deliver incredible medicine while also delivering a great consumer experience. And AI really forces us to reconcile that point of view. And so number one, it starts with transparency. So Anna always introduces herself as an AI member of the WellSpan care team. So it's that transparency right up front that you are engaging with an AI. The second is that we've designed really thoughtful escalation protocols. So what may start as a routine phone call may suddenly take a turn as a consumer may reveal a healthcare need or a situation that they're managing at home. Let's take, for example, something really, really significant like suicidal ideation. What do you do with that? And so we've built a centralized 24/7 care team that receives those human escalation protocols every single time that they happen. They don't happen a lot, but we can't have a failure rate at all. And so we've been able to design into the way the models work when to recognize the need for an escalation to a human care team. And there's other protocols to manage less significant follow-up that might happen the next day or the next time someone sees their provider. But at the end of the day, whether it's our care team or Anna as a part of the care team, we need to recognize that we're treating people with uniquely human conditions.
Yeah, and those edge cases are often the most crucial, the most time sensitive. I love to see the way you're using those examples of where a human in the loop needs to get in there much, much faster and onto your care team. Mark, you'll forgive me if I am a little bit provocative with this question, but I guess from an industry point of view, healthcare has had that perception of not being the most innovative in this space. But I think that's changing now because you're seeing all of these disease mappings, AI helping on diagnosis and multiple different areas. Do you think that perception is changing from healthcare as being maybe perhaps one of the slower industries to bring technology to the fore to one of the most important?
Well, I think it's important to unpack that question in two different ways. So when we reflect on healthcare's legacy for not innovating fast, I think it's important to draw the distinction between the really steady march of clinical and medical advancement that's occurred, where every year there are huge advancements in the way that we care for people. And I think AI will continue to support and make that pace of innovation faster. So that's always existed. Where we haven't really focused the lens, though, is on the business of healthcare, right? Where those are two very different disciplines and competencies. I have colleagues across the country that are doing remarkable work in innovating in the actual space of medicine and clinical care. And WellSpan is doing that work too. But where I see a huge area of opportunity to really lead the industry is the way we're innovating in the business of healthcare. And there is so much application with the use of AI and technology, and simply by listening to our team members to redesign their work in a way that provides a better work experience, that I think gives WellSpan a unique platform in that space.
Tell me about some of the upcoming projects that you've got from a digital perspective and some of the ones you're most excited about in the coming year.
Sure. Well, we're fully embracing AI. And so I shared a little bit about what's happening on the consumer side. On the team member side, we're equally active. A couple areas that I think are really, really important. One is digital diagnostics. So what role does AI play in the way that we diagnose and more rapidly treat disease? WellSpan has over 14 models at full scale that are supporting digital diagnostics. What that means is that in the last calendar year, there were 3,000 people, 3,000 consumers at WellSpan, patients who had disease identified earlier than they would have using traditional modalities. And what that means is we could jump into action, get them into treatment, and put them on care plans that save lives. And so when you think about, we're just scratching the surface of that, what it could mean for the health and well-being of our communities is pretty incredible.
Yeah, and the outcomes that would drive for 3,000 folks having had their illnesses diagnosed much earlier.
Yes, it's remarkable. And then we're also examining all of those problems in that problem-rich environment. So we talked a little bit about workforce shortage and what that means, and our desire to deliver a better work experience for our team members. We're also looking at other areas like in supply chain and in business operations where there's tons of opportunity. WellSpan is leading the way in our entire region with direct-to-consumer drone delivery. So that's kind of breaking news coming soon. We're under contract and working on a really ambitious plan to help people get the things they need to be healthy as fast as possible and with the least amount of friction as possible.
So that's everything from medications to medical supplies, that type of delivery direct to their doors.
Yeah, imagine you have a child who has really, really bad poison ivy, and you are able to connect with your provider virtually, so not have to leave the house. Maybe you have other kids at home too that are running around and you don't have to pack everybody up. You can examine what's happening with that poison ivy, get a prescription for something like a steroid, have the option to add on additional products like calamine lotion and cotton balls, and have that delivered directly to your front door within a couple hours, while just being able to be a parent and stay at home and take care of your kid. So I think it's going to really revolutionize the way we think about healthcare. It's not just the moment that you're in front of us. It's what happens when you get home that really matters. And our ability to support people when they're at home is really critical to our strategy.
Yeah, and I love how that blends the human and the digital experience together.
Yeah.
So when you're delivering those items to those customers as and when they need them, particularly in some of those more emergency type scenarios. You can imagine someone outside, like you said, where they have their kids at home, they've got a flat tire in the car, they can't get everybody going. That's a phenomenal way to really boost the experience that they have at WellSpan and their healthcare in general. Any other AI or digital projects that you're excited about?
How about robotics? This one's cool.
Oh, let's dive into that.
8 years ago, my wife and I had our last child, here at WellSpan York Hospital. And my wife delivered all 3 of her babies overnight. And one of the things that she was most looking forward to after having the baby was a sandwich, cold cut sandwich, because it's advised to not eat cold cuts while you're pregnant. And so the only option was a frozen cheese sandwich after she had her baby because it was overnight. And so that always kind of stuck in my mind. And as you know, you start to learn about the reality of delivering food at scale of an organization this large, it's pretty difficult, right? And I think we do a phenomenal job, but we're not immune to the challenges of operating that. And so we're actually in the middle of construction right now on a fully autonomous robotic food preparation system that consumers will be able to order 24 hours a day right from their phone in the hospital and pick up a warm meal that's literally made to order. And what's kind of cool about it is instead of thinking about that as simply an operational challenge, we're really embracing it as a cool consumer experience. Like, you never could order made to order, unique to you food, particularly in the middle of the night. You really can't do that in many places in general, let alone at the hospital. So we're really excited about how the combination of things like AI and robotics can really bring us to the next level of consumer experience.
And I think it's not often that you would think that you can provide a wow experience in healthcare.
Yeah.
It tends to be problem, solution, customer goes home and ideally has a healthy and long life. But that type of wow experience is absolutely incredible as a value add again for WellSpan.
Yeah, I mean, unfortunately, the bar is set pretty low. So our objective is to not just reach the bar, but to really imagine what it could be and shoot for that.
Yeah, I love how you bring all of that creativity from your experience into how it works today at WellSpan. You've given us some phenomenal insight today, Mark, into WellSpan, healthcare in general, AI. What advice would you have for other digital leaders in the healthcare space on where they should be focusing their time?
Well, number one is to listen. So if you just take the time to deeply understand your user, whether it's in the consumer experience or the team member experience, their insights and lived experience are the most important clues and basis for what you could create next. It's number one. The second is to do the homework on what's happening with AI. You know, it is a buzzword, but it is for good reason. It is a remarkable set of capabilities that are going to change what's possible. And I think it's incumbent on us to stay ahead of that curve by doing the hard work and learning about it, so that when we combine a really unique, deep insight about a user with all these crazy ideas floating around in our head through what's capable with AI, the solutions that we can imagine and then create and then deploy are in a totally new category now. And so I think it's the combination of what's feasible and technically possible with those deep human insights that can lead us into the future.
Yeah, that's a super advice. Let's talk about compliance briefly. It's not everybody's favorite topic, but obviously HIPAA is a huge aspect of compliance here, and one that Sitecore is able to provide. Talk to me about that HIPAA compliance aspect and Sitecore and how that helps WellSpan.
Sure. Well, partnership's critical. So that is true of our external partners like Sitecore and the platforms of capability that help bring all of this to life. And it's true culturally, internally. So inside WellSpan, we do not have that kind of stereotypical culture where partners in finance and legal and compliance are the no people. We all have a shared understanding of what it means to provide a better consumer experience and a better team member experience. And so starting from that same basis and belief of asking what if and then building something that's new, we can come together and figure out how to make it happen in a way that's compliant. And then that becomes easier when we can have partners that come to the table with solutions that are built with that same intent in mind. And that combination of the two means that it's not really the speed bump that it is in other organizations.
Yeah, so it's almost like it's an organizational culture
Yes,
discussion
absolutely.
as well as everything else. How does AI impact that compliance with regulation, and what kind of safeguards do you have to put in place to make sure that you're meeting all the requirements that you need to from a governmental perspective, compliance point of view as well?
Yeah, I mean, so we all have to be operating with all cylinders, right? A lot is changing rapidly, so we have to put the time in to learn and understand it. The second is a really mature and robust governance model, which we already had in place prior to AI. So we have the people, process, and technology in place to ensure that we're prioritizing the right work, that it's informed with the right insights, that it's resourced with what it needs to be successful, and that we have leadership, buy-in, and championship around those projects, and the transparency to ensure that everything we're doing has a direct line of sight to our leaders that can make the key decisions when we have to interpret what's changing in that regulatory environment.
Yeah, I love that people, process, technology. We would use that as well at Sitecore, almost that strategy, methodology, technology aspect. Not always something you see from a technology company, but we know that if you have the people in the processing in the right place, the technology just flows after. And one of my final questions for you today, Mark, is around that technology. What's one thing that you would love to have in your digital stack? If you put your crystal ball in over the next couple of years, what's one capability that you would love to see from a digital point of view?
I think that we will live in a future where technology in many ways will blend into the background. So for over a decade, we've heard things around the Internet of Things and quantified self and the amount of data. But what if there was a future where technology could help anticipate what people needed because we were measuring and quantifying and predicting continuously these huge data environments that we exist in our healthcare environments and at home, so that we could play a bigger role in truly helping people be healthy, recognizing that the time that you're interacting with healthcare in your life is very, very narrow for most people. And it's really the rest of their life that informs their health and well-being. And so how could we harness those larger data sets around how people live, work, and play and add value to their journey towards better health and well-being? So I think that is about all of the ambient data coming together from what people use and interact with and how they live, work, and play, and how they consume care, into some futuristic model where we could be a step ahead of people in their journey towards health and well-being.
Yeah, I like how you think about that, because it's not just necessarily the channel, right? It's not just the website or the app or the Apple Watch notifications. It's how it blends into the entire human experience day to day.
Yeah, I mean, we talk a lot about personalization in the consumer experience. We're equally focused on the horizon around personalized medicine, but this even goes beyond that into personalized health and well-being, which is beyond the medicine part. And so I think that's what I'm curious about.
Yeah, that preventative aspect. Really, really amazing insight. It wouldn't be an episode of Digital Visionaries without a lightning round. I'm going to fire these at you and see what
All
you
right,
think.
shoot.
Feel free to add as much context or otherwise as you want to on these. What was the first healthcare tech project that you worked on?
So there were two that happened simultaneously. One was around the adoption of the electronic health record and by clinical teams so that consumers could have tools in their pocket. And at the same time, the same organization, we had explored the concept of, believe it or not, a custom coffee delivery app for clinical care teams, because there is a human insight that everyone loves coffee and that it would be a real delight in the team member experience if we could just bring you the coffee that you wanted so that you can be more effective in your day.
Love that. America runs on coffee for sure, as does Ireland as well. What's a trend that really excites you in the healthcare space?
I think that our point of view around human-centered design in healthcare is sparking a movement. There have been like-minded healthcare professionals out there, but I think as we see more technical capability advancing, staying true to those insights and the power that it can deliver a better experience is really gonna build momentum. So I think that the evidence is what WellSpan's achieving now, but we really want to be a part of catalyzing that movement.
I'd love to hear that. What is your favorite and most innovative tech company that's not in the healthcare space?
My wife and I have 3 kids. They all are athletes and they're all very busy at school and a ton of activities. And so we really could not live without Amazon Prime. I mean, I don't know how we would function. So overnight delivery is pretty crucial for us and our family. And so we've come to really appreciate that. And it's kind of a testament to how a great consumer experience can really drive loyalty to a brand.
Yeah, I know it's there's hundreds of millions of Amazon subscribers in the US, so you're not alone in that, but a really great answer. What's the best piece of advice you ever got?
The best piece of advice that I ever got was to ensure that the experience of working with me was as good as my deliverables. That in this space where it's our job to try and be a step ahead in understanding trends and capabilities and new experiences, an organization chooses to pursue those when they believe. And so that is earned through influence, and influence is earned through delivering a great experience.
That's an amazing answer and great advice for anybody who's working on larger projects, has a large amount of teams. What's the best cheesesteak in the area?
Oh man. There is in York, Pennsylvania, one of the country's oldest downtown farmers markets, so urban farmers markets, still operates today on Tuesdays, Thursdays, and Saturdays. And it's largely food stalls now, so fewer farmers, more lunch spots. And there's a fantastic sub shop called Hefty Lefties, and they make a fantastic cheesesteak.
That sounds amazing to me. I'm a left-hander myself, so I think I might have to check that out. Steelers or Eagles?
Steelers.
Easy. Mark, it's been amazing chatting with you today. I've really felt that we've gotten phenomenal insight from you. You are the definition of a true digital visionary, and it's been so good. Thanks for joining me.
My pleasure. It's easy when you love what you do.
We'll see you on the next one.